Unless you've attended one of our seminars, you may be wondering, what is cellular inflammation and how does it affect me? Well, first of all, cellular inflammation is the leading cause of most 21st century diseases. Whether it's MS, Alzheimer's, cancer, chronic fatigue, weight loss resistance, or even autism. If you think it's not affecting you, I really want you to think again. So to understand cellular inflammation, we need to take a little visit back to middle school biology. So that's a cell. And around the cell, you have these two lipid bilayers that make up the cell membrane, and they are made out of fat. In a normal, healthy cell, good nutrients go into the cell, and bad toxins come out of the cell. It's called cellular fluidity, when cells can communicate with one another, and it really works well when this lipid bilayer cell membrane is fluid and healthy. With cellular inflammation, there are three things that cause that. We're going to talk about toxins as being the first one. And toxins are really attracted to fat. Well, since the cell membrane is made up of fat, toxins come in and they attach to the cell membrane and adhere to it. Then, because of the standard American diet, which really does stand for SAD if you think about it, we have an overabundance of sugars in our diets, and that drives cellular inflammation as well. And a lot of my clients will say to me, well, I don't drink soda, I don't eat candy, I don't have ice cream, I really don't have that much sugar in my diet. Well, if you're consuming anything that's white or even whole grains, it drives that inflammation up. Whether it's white rice, white pasta, white potatoes, even oatmeal, that drives inflammation up. So now, your cell is inflamed. And we can't get good nutrients in now, and we can't get bad toxins out. And now you've got a toxic cesspool. And now at this point, your cell has two choices. It can either die, which is premature aging, or it can mutate, and that's cancer. And we don't want to see either one of those. So at our clinic, what we do is we help folks to reduce the cellular inflammation, and we do a deep detox, a cellular detox. We're not talking about a foot bath or a colon cleanse. We are detoxing at the cellular level. And unless you're hitting it at this level, you're not really detoxing at all. You're not quite cutting it. I'm not saying those other things don't provide some benefit, and they may, but we've got to get real deep at the cellular level here. So at our clinic, we help folks make transitional choices with dietary changes, superior supplementation, advanced nutritional testing. And to get well, you really have to fix the cell. And this is how we help folks get their lives back.